Everyone is like talking about supplements these days. Some people read the ingredient list, some people basically just overwhelmed by all the social media bombarding, and people are like, are we focusing on the wrong thing? Someone picks up a supplement and immediately scans the ingredients. What are they missing is something that I wanted to like maybe talk about today.
Yeah, no, that's such a good question. I think there is so much noise right now in the supplement industry. Understandably, consumers and patients are completely overwhelmed. It is important to have, some things in mind when you're picking up a supplement to
Yeah,
evaluate if it's right for you. I think there's a lot of really compelling stories online of,
exactly.
XYZ changed my life or this,
Exactly.
improved my bowel motility or this improved my energy. And customers really need to be thinking about what works for them. So some
Exactly. That's perfect because I think most people also like just assume that if the ingredients are there, it must work for me. What is it that matters? Is it the dosage? Is it the formulation? Is it sourcing? Or are most supplements like underdosed? That's also like something that I've been thinking about. Or is there something you personally look at first before even like considering taking a supplement?
Yeah, so I think the three things that I really think about quality, the clinical research or research behind the product, and also, as you said, the dosages, right? You really want to be thinking about you really want to be thinking about supplementation as something that supplements your life. So where you really want to do a quick analysis first is like, where are the areas where I need supplementation in my life? Is my diet maybe deficient in this vitamin or mineral? Is
And I
my
think that's so underestimated. What is it that's like for me?
It allows a little bit more of a personalized approach so that you can really figure out what you need and then accordingly what dosage you need. But I do think that quality is a really important conversation that needs to be everyone's forefront right now in the supplement industry, looking at, where supplement companies are sourcing their ingredients from and how they're third party testing to make sure that what is on the label is actually in the supplement. I think that's really important. There's some great third-party testing companies. NSF Certified for Sport is a great sort of third-party certification to look for because you know that they're doing their due diligence.
And like sometimes you can take two products that can look almost identical, same ingredients, similar claims, but they don't feel the same. Like, can you explain like why that might happen?
Yeah, I mean, I
Or
think
like what's actually like happening inside the body?
there are certain vitamins and minerals that come in different forms. I think like magnesium is probably the one that's like most easily to understand because I think there's the most knowledge about it on the internet right now. So we've probably heard of like magnesium glycinate, malate, oxide,
That's
magnesium
my favorite.
althreonate, right? There's all these different forms. And
Yeah.
just to use this as an example, sometimes you really have to look at the forms of the vitamins and minerals that are in these products to make sure that they're ones that are easily absorbed and ones that your body needs. Methylated B vitamins are another good example. Some people have an MTHFR mutation, which makes them unable to absorb certain B vitamins as easily or readily. And so you want to get methylated versions of those B vitamins if you do have that mutation. So it's something, again, like going back to the beginning, which is looking at what your body needs and then looking for a supplement accordingly versus maybe taking a one size fits all sort of thing. That can kind of explain why two products that may look similar actually feel very different in your body.
And what about like combining different supplements together? I hear that some people say that you shouldn't like take all at once. You should take your supplements throughout the day. Why is that?
Yeah. Well, again, all about personalization, but more importantly, timing does matter and absorption matters, right? Another easy example, vitamin D, A, E, all these fat soluble vitamins are more easily absorbed when they are combined with fat, right? So maybe with a meal, taking it with some sort of food that has some fat to help with the
Yeah,
absorption. So I
yeah,
think
like
it's
my vitamin D is like with a olive oil, I think.
Exactly. Yeah. And some supplement companies are great about going ahead and making the most bioavailable formulation that's out there. But that's not the case for everything that you find. So you do have to be a little bit vigilant and make sure that, okay, if I'm buying this certain vitamin or mineral, how is it best absorbed? And then timing it accordingly. Does it need to be taken with food, without food, on an empty stomach? Is it better to be taken in the morning? Is it better to be taken at evening? All of that really depends on what you are supplementing.
Can you go into more like details in terms of like, okay, you put a pill in your mouth and then what happens? Like what's like step by step? I mean, we know it's like not absorbed well, but like what is it actually happening? Why
Yeah,
not?
no. That's an excellent question. I will say it's the term that's known now as like supplement delivery technology. There's all of these different
Yeah, exactly.
yeah, there's all these different patented ways to get some of these vitamins and minerals to be the most absorbed, right? So
Mhm.
you probably heard of liposomal, or there's some that are,
Yeah,
liquid, there's
yeah.
chewables, it's all different form factors. It really depends on what you're taking, but from a capsule perspective, it is mostly opening up in the stomach and being mostly absorbed into the small intestine, right? I think some people forget the difference between the stomach and the small intestine, and they think all of the absorption and digestion and everything is happening in the stomach, which again, from pop culture, that's the organ that we think of when it comes to digestion. But
So
there's
basically,
so
the goal is to make sure we get that little guy through the stomach, large intestine, all the way to the small intestines to like be absorbed there. But
ideally.
so the problem is like most tablets or pills, by the time they get there, they're like what?
Well, they might be degraded, and so it depends. Like there are certain formulations of vitamins and minerals, S and B vitamins, so like B12. You might see sublingual lozenges that you can put under your tongue, or they also have these
Exactly, that's
sprays.
what I had.
Yeah, there's also now a whole lot of different liposomal formulations that created and sort of evolved for the best absorption. That's where I would say
Interesting.
go leaning back on the research as well, going back to the company and seeing if this specific molecule that they're utilizing has been validated in some pharmacokinetic studies to look at whether it's being absorbed or not, I think is really important.
hmm Very interesting. Thank you. How do you like actually choose quality? You said you check the testing, transparency. What else did you say?
So obviously research I think is hugely important. If a company is taking the time and the financial investment to do research on their finished formulas or their products, if they have single ingredient products, it's a huge green flag because it is really something that the company is usually doing on their own. And it does take a lot of financial resources. It also takes a lot of staff and labor to make those clinical studies run. From the quality perspective, looking at their sourcing practices, there's some really wonderful leaders in this space talking through how they are going back to the source of some certain ingredients. Also, like working with the places that may be growing the ingredients, whether it's oranges for vitamin C, and looking at the actual growing practices. That's huge. It also is another opportunity for the supplement industry and the wellness industry to support farming practices, right? And then third party testing. So right now there are a couple independent organizations, NSF being I think the top tier, where they will come in and make sure that everything that you're saying is on the label is actually in the product. And they do that for every batch that you create. So at least you have that
Okay.
assurance knowing what you're getting is actually in the product.
Do you think Amazon is a good place to buy supplements from?
There's been so much controversy in the last few years about Amazon. I think some companies are now really taking ownership of being the direct channel to Amazon versus I think in the past there used to be
It
maybe
looks like it has improved, right?
I definitely think it's improved.
Of course, you also work in actually mainly like in integrative oncology, which is obviously a completely different level of responsibility, I would say. And I have so much respect for you. When you're working with cancer patients, I guess supplementation isn't just casual anymore. What mistakes do you see people making? Are there cases where more supplements actually cause harm? Or like, do you find patients coming in already like taking a long list of things and you need to like pause them? How do you personally approach supplementation during active treatment? And just curious, like, is it more minimal or more strategic?
Yeah, I love this question. I think there needs to be way more education about this in the public. So, for those who don't know, I'm board certified in integrative oncology. I've been practicing specifically with cancer patients for the last decade and supporting them both through active treatment and then also survivorship. This is an area, there's a lot of misinformation online and it's a very vulnerable population. So, it's very easy for them to be told by a friend, hey, look up this tea. I heard it cures cancer, or look up this supplement. I heard it's great. And where I really take the approach of harm reduction with my patients. So I have a very sort of open door policy of, hey, come in and tell me everything that you're taking.
Taking
Please don't withhold anything. I want to know if you're trying
everything.
something
Yeah.
experimental or doing an off-label medication, very non-judgmental parent, and have them at least have that transparency with me so that I can do the harm
Yeah,
reduction
of
conversations.
course.
What I find happens most is yes, there's a laundry list of supplements that a lot of patients come to me with, which usually my patients can attest to this. They will leave on probably a third of those supplements, but I really, really slim it down. Less is more here. The other thing is you are dealing in active treatment with a lot of really intense chemotherapeutics or immunotherapies, and there is the risk of drug herb interaction with some of these chemotherapies,
When they're
right? So
overlapping.
exactly what can happen is some of these supplements can actually make the chemotherapy less effective or cause maybe additional side effects. So you
Yeah,
really want to be evidence-based here and
yeah.
strategic. So a lot of supplements is first a red flag. The other thing is I find underdosing happens a lot in this area. There are
Underdosing.
underdosing. Yeah, I think it gets diluted, right? Because they come to me in a list of 10 different supplements thinking that, oh, I'm on so many things, it must be doing something. But they might be on 10 different supplements at very, very, very low dosages. So what typically I will
Oh,
do is look at what the highest yield supplements are for their cancer type and for the treatment that they're on, and then get them at a therapeutic dose.
mm,
Therapeutic dose means that it's actually causing a synergistic effect or it's meant to be therapeutic, right? Versus
interesting.
just taking
And
yeah,
that
taking a small
applies
dose.
to everybody,
Where
I guess.
exactly. Well, and that goes back to the personalization that we spoke about in the beginning. Curcumin is one that I see comes up all the time in this space. So almost every single one of my patients will come to me on some sort of turmeric or curcumin supplement. And there is some evidence in certain chemotherapies, so a very small list, but certain
Mm,
chemotherapies where curcumin can be really synergistic and actually enhance the efficacy of the chemotherapy while reducing the side effects. But what I find is that most patients are underdosing this one. Turmeric is
underdosing.
underdosing. Turmeric is the root. Curcumin is one of the
Yeah, I was
medicinal.
about to say.
Yeah. So turmeric, again, is you can buy it at the grocery store. It's used in a
Yeah,
lot of cooking. You can buy the
yeah.
spice.
And you need
Uh,
to combine it with black pepper,
Not
correct?
always, not always.
Oh,
Yeah.
really?
There is now a lot of different curcumin delivery technologies which allow for absorption. Essentially, curcumin is one where it does need a little bit more digestive power to absorb, which is why it was typically paired with something like black pepper or ginger. The black pepper and the ginger actually enhance digestive process, allowing more of the curcumin to be absorbed. But that has evolved greatly. Now we have, nanoparticle sizes of curcumin that can be easily, readily absorbed. There's liposomal versions. There's so much in the
So
curcumin
many.
world. What I find is that people take turmeric, which again is the root, versus the curcumin, which is the medicinal component, and they'll take, 500 or 1,000 milligrams of turmeric, but it might only have like 25 milligrams of
When you say
curcumin.
turmeric, like the supplement version or the powder,
Yeah,
like
the
the one that
supplement
we
or the
actually use
powder.
during cooking?
Yeah, the supplement or the powder. What we know is
Powder.
that to get like a therapeutic version or a therapeutic amount of curcumin from let's just talk about the turmeric powder, right? The one you'll use in cooking. You need to like upwards of 10 teaspoons, which
Oh,
no one's
wow.
typically taking, right? So,
Yeah,
and
and
that
the
again,
taste is not great.
yeah. Quick disclaimer, not recommending everyone takes 10 teaspoons of turmeric. Obviously, this is for a very specific patient
Yeah,
population, very specific condition, but I just find that that is like the most common underdosing that I see.
that's so
Just
interesting
because
because I tend to like add it in my warm water in the mornings.
well, and if you're adding it as more of a maintenance, it's a ritual and you like it, that's great. But if you're using it specifically for a targeted symptom, whether it's inflammation, whatever it is, then you maybe need to be increasing the dose to be at a therapeutic dosage.
Mm. Is it protective though? Like, is there any benefits to prevent you from getting cancer or something? I know it's a big statement to make, but
Yeah, no, a good question. I think that again, we'll come back to personalization. It really depends on what your risk is. Depends on whether you have maybe a genetic predisposition for a certain cancer type. Because in that case, there are some preventative protocols that we can implement to help reduce the risk of cancer, right? But
mm,
is taking turmeric blanketly going to reduce the risk of recurrence or risk of developing or recurrence?
yeah.
No,
I
that's where
guess
I,
it's just like a just one supportive
yeah.
ingredient.
What
Yeah.
we do know, though, is that the more plants that you have in your diet help develop a very diverse gut microbiome. So the more nutrient diversity and density that you have increases your gut microbiome. And there is a lot of health outcomes that are associated with a good, healthy gut microbiome. But what I would say is turmeric is yet another herb or spice that you're adding in that adds to that nutrient diversity. So there is benefit, but we can't make that the cancer claim with it for sure.
What else is something that we should talk about when it comes to your field? Anything else I
Well,
should ask you about?
I think the other thing that is really important and more so than ever, honestly, I think we're going through a really globally intense and stressful time right now. While there's a lot of stuff happening on a macro level, for a patient that's going through treatment, there is even more stress and more angst and, just a lot that they're carrying. I think it's really important that, supplementation is one thing, but the sort of mind-body connection and having nervous system regulation and having building practices that help you feel a little bit more regulated and in your body could not be more important right now because I just give so much credit to my patients who show up for treatment on days that maybe they're feeling okay, but they know that a few hours after or potentially a few days after their treatment, they're going to feel like crap and they still show up. And I think that is just, I can't applaud enough. As a practitioner, I'm in awe constantly of my patients. But a lot of conversations I've been having lately with my patients are about how do you keep your nervous system and your sort of energy protected right now? Really crazy time. I just kind of want to send a little bit of energy out to anyone that's going through a treatment right now because it's harder than ever, I think. To stay positive and have the hope and when there's so much out of our control on a global scale right now.
Yeah, I really appreciate you adding that to our conversation because I think it's so important. Like it's probably like the most important thing. I almost want to like just post about this only on No BS. Like you can add all these things to your routine, but if you're not cutting out stress, and I know it's like almost impossible to cut
Yeah.
out the
Yeah.
entire stress. And a little bit of stress is actually good for you. But I'm saying it should be like probably the number one thing that we should be talking about
Yeah.
when it
And
comes.
there's such a clear, there's such a clear pathway between how stress affects our immune system and our nervous systems. And for patients going through treatment, we want to do everything we can to enhance their immune system right now. And the suppression of the immune system secondary to living in fight or flight or being in this more sympathetic state is really hard to overcome. So yeah, I completely agree. We should more PSAs about this and more tools for patients and also like just more boundaries on people's energy right now. It's a lot.
I love this. I love this conversation so much because I think it really shifts how people think about preventive health or longevity. So I really, really appreciate, like, thank you so much. I love that you bring like both clinical lens and the industry lens to this. And obviously, like, it made the conversation so much more grounded and supported, I guess. So this was such a good one. Thank you so
Of
much.
course. Thanks so much for having me.